And now to the latest on the coronavirus. The United States is reporting the highest number of deaths in a single day.
U.S. economic growth shrank 32.9% in the second quarter.
1.5 million Americans filed for unemployment last week.
The dire health and economic situation the world now finds itself in really reflects the history of pandemic diseases. Diseases caused by pathogens and viruses from animals like rats, birds and bats that harbor novel coronaviruses which our human immune system does not recognize and cannot defend. The periodic emergence of these animal viruses has highlighted a persistent concern in the healthcare community and our economy, the need for effective pathogen clearance techniques for human blood and biologics. Unfortunately, we are now experiencing a worldwide pandemic caused by the COVID-19 virus, with great morbidity and high mortality in the elderly, minorities, and those with pre-existing conditions. Human blood, the carrier of our immunity, is our most important biologic for fighting disease. Some of our most vulnerable cancer patients depend on clean, virus-free blood plasma. So too, the need for clean plasma is in high demand for COVID-19 patients. Yet, blood transfusions come with a serious risk of passing on unintended live virus. Current techniques utilize chemicals, heat and radiation that are not entirely effective for removing all viruses and are often harmful to beneficial proteins called antibodies. A better, more rapid approach is urgently needed. Aphios is developing a virus clearance technology called CFI for the rapid inactivation of pathogens and viruses in blood products and biologics. CFI is purely physical, very much like the popping of a balloon. It does not use heat, chemicals, or radiation like competing technologies. CFI is both safe and effective. We are raising money to build a CFI prototype for testing and using blood banks and the intensive care units of hospitals. This device will be mobile for use under normal hospital conditions and in pandemics, and rapidly transportable to hot zones in developing countries.
Pandemics and plagues are inevitable. What is not certain are what pathogens cause them, when will they happen, and how will the world respond. Vaccines and treatments against novel pathogens can take months, if not years, to get to patients.
Aphios is developing a technology that can rapidly respond to such pandemics. With your generosity, we will be better positioned to provide virus-free plasma, vaccines, and biologics that can save countless of lives and help us prepare for future pandemics. Thank you so much for your attention.